Welcome to the deep dive. Today, we're plunging into a topic that might surprise you with its complexity and impact. Equine atrial fibrillation, or AF. This isn't just, about a horse's heart rhythm. It's a condition that can really undermine an athlete's career or profoundly affect a companion animal's quality of life. Our sources for this deep dive have revealed some, well, truly remarkable insights into navigating these hidden challenges of equine heart health. We're going to try and distill those crucial facts and surprising discoveries, giving you a comprehensive understanding without, hopefully, the information overload.
Yeah, and what's particularly striking about AF in horses is its spectrum go from almost imperceptible to drastically performance limiting. Untangling it means delving into everything from its kind of unique physiological predispositions to the incredibly sophisticated diagnostic and treatment approaches available today. Our goal here is really to extract the most vital knowledge, offering you that well-informed shortcut.
Exactly. So our mission is to explore the nuances of equine AF, what causes it, how it's pinpointed, the advanced treatments on offer, and what it all means for our incredible equine partners. Let's begin our exploration. Okay, so to really grasp the challenges of equine AF, let's start with the basics. What exactly is it, and why is it such a significant concern in horses?
Right. Equine atrial fibrillation is the most common clinically relevant cardiac arrhythmia in horses. Think of it as electrical chaos in the atria, the heart's upper chambers. Instead of nice, organized electrical signals, you get this rapid, disorganized activity. And that leads to what vets call an irregular cardiac rhythm.
Okay.
This basically means the heartbeats come at truly inconsistent, unpredictable intervals. No pattern. When a vet listens, they'd probably notice variable intensity heart sounds and pulses, and inconsistent diastolic intervals, too.
Irregular. That really paints a picture, doesn't it? A heart's struggling to find its rhythm. Does this chaos always present the same way, or are there different forms of AF?
That's a great question. No, AF isn't just one single thing. It can be paroxysmal.
Paroxysmal.
Yeah, meaning it starts and then stops on its own, usually within 48 hours.
Yeah.
Or it can be persistent or even permanent. What's truly fascinating and often surprising is that for AF to even happen, a certain amount of atrial tissue has to be involved to critical mass. And horses, well, they naturally have a large atrial mass and a high vagal tone.
Vagal tone, that's the nerve thing that slows the heart.
Exactly. That combination makes them uniquely predisposed to developing what we call lone AF.
Lone AF.
Meaning it can just happen, even in a horse with no other obvious underlying heart disease.
Wow. So it's not always a symptom of something else going wrong. It can be sort of an inherent vulnerability.
Precisely. While lone AF is definitely a thing, there are other factors that can push a horse towards developing it. Things like structural changes in the atria remodeling, fibrosis, scar tissue, basically. Also low potassium levels, maybe from lots of sweating or certain drugs. And other arrhythmias like atrial tachycardia or atrial flutter can play a role. These all kind of highlight the intricate balance of the equine heart.
Right. And what's the actual impact on the horse's day-to-day life or, its performance?
Well, at rest, it's interesting. In many cases, especially without significant underlying disease, AF might not actually change the cardiac output much at all.
Really?
Yeah, but the story changes dramatically during high-intensity exercise. Horses with AF can see their heart rate jump up an extra 40 to 60 beats per minute compared to their normal rhythm.
Whoa!
And that leads to a significant drop in cardiac output and, crucially, their exercise capacity. This is exactly why it's such a big deal for performance animals.
Makes sense. Are certain breeds more susceptible to this, more prone to this challenge?
We do see it more often in standardbreds, draft horses, and warm bloods. And while AF can certainly be present in horses suffering from congestive heart failure, or CHF, it's really important to understand that AF itself isn't the cause of the CHF. It's often there alongside it, but it's not driving the heart failure itself.
Got it. Okay, so if you're an owner or a trainer, how would you even start to suspect AF? What are the typical signs that might, trigger a vet visit?
For those high-performance horses, the most common red flag is usually a noticeable exercise intolerance. Maybe they just can't perform like they used to, or they suddenly slow down during hard work.
Okay.
But for horses doing lighter work, it can honestly be an incidental finding. The vet picks it up during a routine checkup, and the horse shows no obvious clinical signs at all.
So it can be quite subtle then? But are there more severe signs? Things that should really ring alarm bells?
Oh, yes, definitely. More serious things owners might report include exercise-induced pulmonary hemorrhage.
Bleeding from the lungs.
Yeah, EIPH. and it can be quite profuse sometimes, or even episodes of weakness or outright collapse. Then during the physical exam, that irregular heart rhythm is the absolute key finding. Vets also listen for those variable intensity heart sounds and pulses, and often the fourth heart sound is absent.
Okay.
And of course, if there's underlying heart disease causing or contributing to the AF, you might hear cardiac murmurs as well.
So the physical exam gives some really strong clues. But to truly confirm it's AF and not something else, what are the next steps, the diagnostic process?
Right, that's where the more advanced diagnostics become essential. You really need to distinguish AF from other irregular rhythms that might sound similar. Things like second-degree AV block, that's where some beats just get skipped, or atrial flutter, which is more organized than AF, but still an abnormal rapid rhythm.
And for that definitive diagnosis, I'm guessing the electrocardiogram, the ECG, is the gold standard here.
Absolutely. An ECG gives you that essential electrical map of the heart's activity. On an ECG trace from a horse with AF, you won't see those clear P waves, the little bumps showing the atria contracting properly.
Right.
Instead, they're replaced by these baseline F waves, fibrillation waves. They can look coarse or fine, and they're happening super fast, like 300 to 500 times per minute. You also see that hallmark irregular RR interval, meaning the time between the main beats varies randomly. The QRS and T complexes, which show the ventricles working, usually look normal in shape, but their height, their amplitude might vary.
And I imagine for performance horses, seeing how it behaves during exercise is key.
Exactly. And exercising ECG is incredibly valuable for them. It lets us see how their heart rate responds under stress and, crucially, helps determine if it's safe for them to continue working or competing.
Beyond the electrical picture, do vets also need to look at the heart's actual structure, the physical side?
Yes, absolutely. Echocardiography, that's cardiac ultrasound, is equally critical. It's interesting because many horses with that lone AF might actually have echo exams that look completely normal. No obvious underlying disease.
Huh.
But it's still vital to check. You need to assess for things that could be predisposing factors or indicate deeper issues, like is there any atrial enlargement, especially the left atrium? Is there any valvular regurgitation, leaky valves, particularly the mitral and tricuspid valves? These structural findings can really influence the prognosis, how things might go.
Makes sense. And finally, what about blood tests? Do they play a role?
They're not directly diagnostic for AF itself. They won't tell you if the horse has AF.
Oh.
But they can definitely help identify predisposing factors. For instance, an electrolyte panel can pick up low plasma potassium,
Right.
which can happen from excessive sweating, especially in performance horses, or sometimes from using certain medications like furosemide, the diuretic.
Okay, so once AF is confirmed, what are the main goals? What are vets trying to achieve with treatment?
Well, the primary goal, especially for performance horses that don't have significant underlying heart problems, is to get them back into normal sinus rhythm, or NSR. That's the heart's natural healthy beat.
Right. Restore the normal rhythm.
Exactly. Now, if converting them back isn't successful, or maybe it's not the best option for that particular horse, then the focus shifts. It becomes about assessing safety for the horse and rider, and sometimes managing the heart rate to keep it in a safer zone. And then, of course, for horses where AF is happening alongside severe issues like congestive heart failure, treatment is more about palliative care, managing symptoms.
Okay, so restoring normal rhythm is often the target. What are the main ways to do that, the main approaches?
We primarily rely on two major strategies.
Yeah.
Pharmacological cardioversion, which means using drugs,
Okay.
and transvenous electrical cardioversion, or TVSE, which is a more high-tech electrical procedure.
Let's tackle the drug route first. Quinidine seems to be the main player there. How does it work?
It is. Quinidine sulfate or gluconate is definitely the drug of choice historically and still very common. It's a class IA antiarrhythmic drug. Basically, it works by prolonging the time the heart muscle cells take to reset after firing it, extends the action potential duration. This helps break those chaotic little electrical loops, their entrance circuits, that keep AF going. It's usually given orally, often through a nasogastric tube.
And how well does it work? What's the success rate like?
It's actually pretty good. Approximately 80 to 85% of horses convert back to a normal rhythm with quinidine. Success rates are definitely better if the AF hasn't been going on for too long, ideally less than 4 months, and if there isn't significant underlying structural heart disease.
80 to 85% sounds quite effective, but I feel like there's a but coming. I've heard quinidine can have some serious side effects.
You're right. There is a significant but. Quinidine has what we call a narrow therapeutic index, meaning the dose needed to work is unfortunately quite close to the dose that can cause toxicity. Side effects are common. And yeah, they can be severe. They range from GI issues, colic, diarrhea, even ulcers in the mouth, to much more life-threatening cardiovascular problems.
Like what?
Things like hypotension, dangerously low blood pressure, or changes on the ECG like prolonged QRS and QT intervals. These significantly increase the risk of developing dangerous ventricular arrhythmias,
Oh, wow.
and sadly, even sudden death in some cases. We also see neurological signs sometimes, like ataxia, wobbliness, bizarre behavior, even respiratory obstruction, skin reactions like hives, and laminitis has also been reported.
Goodness, that sounds like a really challenging drug to use. How do vets manage that risk?
It requires extreme vigilance. Continuous ECG monitoring is absolutely critical during quinidine treatment because paradoxically, these drugs meant to stop arrhythmias can sometimes cause them they can be proarrhythmic. So treatment is typically stopped immediately if the QRS or QT duration on the ECG increases by 25% or more from baseline, or, of course, if any of those severe side effects start showing up like a really rapid heart rate, convulsions, or trouble breathing.
Okay, so that's the drug approach with its benefits and serious risks. What about the other option you mentioned, TVSE, transvenous electrical cardioversion?
Right, TVSE. This is a much more specialized procedure. It involves delivering a precisely timed electrical shock directly to the atria. This is done using catheters that are carefully guided through the veins right into the heart chambers. And it's all performed under general anesthesia.
That sounds incredibly advanced. How effective is it compared to quinidine?
It's very effective. TVSE has a really high success rate, typically over 95%.
Over 95%.
Yeah, even in horses that didn't respond to quinidine,
Right.
or horses that have had AF for a long time. The big advantages are that you avoid all those systemic toxic side effects of quinidine, and horses generally can get back to training much faster.
So given that high success rate and fewer side effects, is TVEC always the better choice? Are there downsides?
Well, it's not quite that simple. TVEC requires very specialized equipment and, crucially, highly trained personnel, cardiologists, anesthesiologists familiar with the procedure. So its availability is pretty much limited to major referral hospitals or university centers, and it is significantly more expensive than quinidine treatment.
Ah, okay. Accessibility and cost.
Exactly. And another important point, even with that high initial success rate, the recurrence rate for AF after TVEC is still pretty significant. We're talking maybe 30–40% risk of it coming back.
Interesting. So even the high-tech fix isn't always permanent. Is there ever a situation where doing nothing, no treatment, is actually a reasonable option?
For some horses, yes, particularly those not involved in demanding athletic careers, or maybe older horses, or those that are showing absolutely no clinical signs related to the AF. In those cases, leaving them in AF might be considered.
But surely there are risks.
Absolutely. And that's why an exercising ECG is highly, highly recommended, even if you choose not to treat. You need to make sure they aren't developing dangerous ventricular arrhythmias when they exert themselves, because that could lead to collapse or even sudden death.
Right.
So it's an option for some, but generally not considered suitable for high-performance horses where maximal cardiac output is needed.
Okay, that makes sense. Looking ahead then, once a horse is diagnosed, maybe treated, what does the future hold? What's the prognosis generally like?
The prognosis really hinges on several key factors. One of the biggest is the duration of the AF before treatment. Horses where the AF is caught early, say less than 4 months duration, generally have a much better chance of successful cardioversion and staying in normal rhythm long term.
And if it's been longer?
Chronic AF that's been going on for a while, leads to changes in the atrial tissue itself, something called electrical remodeling. This remodeling makes the tissue more prone to sustaining AF, so it becomes significantly harder to convert back to normal and harder to keep it there even if you do convert it.
And what about other heart issues? How do they play into the prognosis?
That's the other major factor. Those lone AF cases we talked about where there's no significant underlying structural heart disease, they have a much better prognosis overall. But if the horse has significant atrial enlargement or severe leaky valves or other problems with the heart muscle itself, those things definitely reduce the chances of successful conversion and significantly increase the risk of the AF coming back.
So recurrence after treatment is a definite possibility then. How common is it?
It is. The recurrence rate is quite notable, actually. It can range anywhere from 10% to upwards of 40%, especially within that first year after successful conversion.
40%, that's quite high.
It is. And certain factors increase that risk. Things like larger atrial size on the echo, having had AF for a longer time before treatment, the presence of underlying heart disease, especially leaky mitral valves, and if they've failed cardioversion attempts before. And interestingly, our sources suggest stallions tend to have a higher recurrence rate than mares or geldings.
Huh. Interesting. But if a horse does successfully convert and they don't have major underlying issues, can they really go back to being a top athlete?
Yes, absolutely.
Yeah.
For horses that convert back to NSR and don't have significant underlying cardiovascular disease, the prognosis for returning to their previous level of athletic performance is generally considered excellent. That's a really positive outcome we aim for.
That's great news for many owners and trainers. But what about the horses that don't convert? Or where treatment isn't really an option? What's the outlook for them living with permanent AF?
For horses with permanent AF who aren't candidates for conversion, they can often still live a normal lifespan and potentially be used safely for lower-level athletic activities. The key benchmarks are ensuring their heart rate during exercise stays below about 220 beats per minute and that they don't develop any dangerous exercise-induced arrhythmias. However, for those horses where the AF is complicated by significant valve problems or especially congestive heart failure, the prognosis becomes much more guarded, potentially even grave. These horses often face a much shorter useful performance life and, unfortunately, a shorter overall life expectancy.
Right. Finally, are there any sort of preventative measures, things owners or vets can do to maybe minimize the risk of AF developing or coming back?
Well, some things can help manage risk factors. For example, discontinuing certain medications known to affect electrolytes, like furosemide or maybe bicarbonate milkshakes, sometimes used in racehorses, if they aren't strictly necessary. Administering potassium or other electrolytes if blood tests show they're needed is also important, especially after heavy sweating. In some specific situations, vets might consider medications like ACE inhibitors, which can potentially help minimize that atrial remodeling and fibrosis over time. There's even been some exploration into things like vitamin C administration, though the evidence there is still developing. It's really about optimizing overall heart health and managing known risk factors.
Wow. This deep dive into equine atrial fibrillation has certainly shed light on just how sophisticated veterinary cardiology has become. From understanding those sometimes subtle signs to exploring these really cutting-edge treatments, it's clear how complex and, frankly, how dedicated equine heart health management truly is.
It really is quite remarkable, isn't it? And what's so fascinating is how the horse's unique physiology, that big atrial mass, the high vagal tone, makes them particularly susceptible to AF. It sets them apart from many other species in this regard, and it really underscores why it remains such a distinct challenge and an active area of ongoing research.
So for our listeners, what's the key takeaway here? What should they be thinking about after hearing all this?
That's a good question. Perhaps the most compelling thing to consider is that delicate balance that medical professionals constantly navigate. The balance between achieving therapeutic efficacy, making the patient better, and ensuring patient safety, especially when treatments themselves, like quinidine, carry significant risks. It really highlights the profound dedication and the incredibly careful observation required, not just in specialized veterinary care like this, but honestly, across all fields of medicine. It's a universal challenge.
That's a truly profound thought, and it definitely resonates beyond just the equine world. It's a powerful reminder that while the horse's heart is such an emblem of strength and endurance, it can also be incredibly delicate. Well, thank you for joining us on this deep dive into equine atrial fibrillation. We hope you feel much better informed, maybe gain some surprising insights, and perhaps have an even deeper appreciation for these magnificent animals. We look forward to unpacking another stack of sources for you very soon.